I'm Patrick Bryan, the Program Director of the Internal Medicine Residency Program at St. Elizabeth Youngstown Hospital. I'd like to take a moment and introduce you to our program. We are a fully accredited program established in 1967. We have a complement of 33 categorical residents with affiliation of 3 major medical universities where our students complete their rotations. Those include Northeast Ohio Medical University, Lake Erie College of Medicine, and Ohio Heritage University College of Medicine. Here at St. Elizabeth's, we pride ourselves on our diversity, where we will continue to recruit both nationally and internationally with the hopes of maintaining and fostering our mission. We strive to care for those in our community who are underserved. Among the many highlights of our program is our ability to maintain structured didactics, excellent experiential and technical exposure, as well as scholarly advancement. We've been awarded the gold medal by the Ohio chapter of the American College of Physicians Scientific Annual Meeting 3 times in the recent past, and we will continue to strive to represent and present at regional and national meetings as well as publications throughout the upcoming years. In addition, we've maintained academic excellence, where we've achieved 100% board pass rate on a 3-year rolling average in the eyes of the American Board of Internal Medicine for first-time test takers. We hope to continue that trend, as well as maintaining our balance in structured didactics, as well as experiential exposures for those to meet personal goals. We're looking for candidates who are enthusiastic, open-minded, and who share in our mission.
I had hoped to get into St. Elizabeth because I had family nearby, and it was, as an immigrant, it was important for me to have a good support system as I went through residency. St. Elizabeth looked good on paper, excellent board pass rates, prolific award-winning researches, and alumni seemed to end up in solid fellowships and places. So that's what attracted me to St. Elizabeth at first. But it wasn't until I interviewed here and I met the people and I did my 1-month rotation that I actually wanted to be here. I saw the relationship of the residents with each other, with the attendings. Residents were very much knowledge-based. Attendings would listen, would pay attention, and would support the residents. And really, that's what I wanted to have. And in the end, the support that I wanted didn't just come from my family, it came from within. And St. Elizabeth really became a family for me. If you had told me 5 years ago when I came here that I would be where I am at now, I wouldn't have believed you. But that's what St. Elizabeth Internal Medicine Department does for you. It recognizes what you have, it nourishes it, it encourages it. And I knew I wanted to teach, I just didn't know what my capabilities were until they encouraged that.
I think you'd find here at the hospital that it's a community, and it's broader than just the Youngstown. You'll interact with residencies from the 3 surrounding hospitals at St. Elizabeth Warren, and then St. Joe's Warren, and then also St. Elizabeth Boardman. So there's different residencies, there's opportunities to learn different practice environments. You'll learn in different types of communities, which also helps as far as you're getting some experience in residency. And that's what we aim to do, is prepare you for practice in all different situations.
I actually graduated from this program in 2021, and I became core faculty that same year. I can say that this program is excellent in making sure that you are prepared not only for the clinical side of medicine, but also the academic side of medicine. You will be able to know your information, be able to not only know that information for the boards, but also be able to incorporate that into clinical practice.
I was fortunate enough to be a medical student here before I became a resident, and I saw myself go from someone who collected information and reported that information back to my residents and my attendings into someone who could look at a problem that someone was having and look at it from a diagnostic perspective, think about the next steps that I would do as a physician and where I would go from there. And to be able to step into a resident role and actually put that into action has been a phenomenal experience.
I mean, we all say like we support each other and all that, but I think everybody's just genuine, with one another, and you see their concern for one another, not to bring you down, but to lift you up and really encourage you and support you all the way as you're going through the residency program. And not only with the co-residents, but with all the faculty, with our program directors and our secretaries and all the ancillary, staff and everybody.
I think I forgot to mention something that really stuck out for me during the after the matching process. I feel like we have one of the best program coordinators as well. Helping as an international student, I know it was a bit challenging for me at the time with the whole processing visa and other things, but they were really very, very patient and also very, accommodating with so many things, and I really appreciate it.
Well, hello everyone. My name is Kathleen Harley. I'm the president here at St. Elizabeth Youngstown. And today I'm going to be with you as we go through more of your virtual journey, specifically looking at the residency living quarters. What I am so interested and happy to let you know is we have now a revamped 18-room residency quarters. Within those quarters, you will find a great dining room, common area, computer lab, and just an overall comfortable place to be. We have focused on this because we know how important your clinical competency is, but we also know you have downtime that's needed, and we want that downtime to be able to be productive. This is our commitment as administrators to our GME program. We are so thankful for the great program that our faculty and our associates have put forth. And this is our way to give back to that same commitment they're committed to every day to give you a great experience.
Here at St. Elizabeth's, we look forward to fostering the growth of future leaders of medicine. We will continue to strive to maintain excellent balance and expand on the opportunities that currently exist. With the continued strong support from our administration as well as graduate medical education, we look for evolution with further online experiences and structured didactics, including a hopeful program and point-of-care ultrasound. Our faculty are dedicated to our residents with continued hopes of mentoring so that they may reach their personal career goals, whether those are fellowship acquisition, hospital medicine, or primary care. We strongly hope that you consider our program and the opportunities that exist at St. Elizabeth Youngstown Hospital and within the greater Youngstown community, as well as our call to serve.